what is normal, further including promoting better self-care. In other words, if you can be able to know and understand the proper issues about your health in terms of being aware, you can now be able to take what we may call a kind of especially when our body is normal or when it is abnormal, because you are very, very aware, you understand the issues of your body. You can now be able to say, look, my body is normal or my body is not normal. So these are some of the issues that has to do with being aware of our health. Then again, in the community where we stay, if we can be able to know the issues of be able to be aware of health issues or understand areas of awareness of our health, we can also be able to understand and prevent issues of diseases outbreak like cholera and so on and so forth. If we are very, very aware, we know those things that we can take to prevent cholera awareness, especially when it comes to the waters we drink and some other preventive measures that has to do with issues of health. We can also be well educated, or rather educate the entire community to be able to understand these kind of preventive measures. Also, it can also prevent better lifestyles. If we are very, very much aware about issues of health, we can be able to have a kind of better health lifestyles, and also be able to create awareness programs in schools, like, for instance, in Caleb University, where you can be able to create such a health awareness. So going forward, I believe today that we've invited experts who can be able to speak very well in terms of health awareness. I'm only an educator, and I'm not an educator in health factors or in health areas. I'm only trying to create the necessary awareness in terms of opening this very program, so that those professionals in the area of health awareness can be able to take the lead and be able to educate us the more, so that going forward, we should be able to know how to at least prevent issues that has to do with health in our bodies, and of course, create the necessary awareness in our various communities. So by this, I want to welcome all of us, and of course, open the doors for this very program to kickstart. And on that, I say thank you very much for inviting me. Thank you, Mrs. Falobi, for this very educative topic. And thank you all the students who are here today. And I pray that today's topic and today's program will be able to be an enabler and be an eye-opener to all of us to be able to understand the issues of health awareness. Thank you very much.
Thank you very much, our HOD, Dr. Ogbonna, for that insightful and encouraging opening remarks. So at this point, we will now proceed to the next part of our program by inviting our first speaker. Our first speaker here today is Dr. Eunice Odeyemi, a senior registrar in the Department of Pediatrics at Lagos State University. She has a keen interest in hematology and research on sickle cell disease. She's passionate about children's health, and she has been actively involved in children care, research, and community health education. Dr. Odeyemi's long-term goal is to specialize in pediatric hematology and advance evidence-based care for children in both Nigeria and in abroad. So she'll be taking us through the topic, what is sickle cell and the prevention strategies? Please join me in welcoming Dr. Odeyemi.
Thank you, Ms. Bolanle. I am honored to be here today, to be invited for the program like this. First, I want to appreciate the HOD of the Department of Mass Communication, Dr. Sunday Ogbonna, and Mrs. Falobi, the course lecturer, and every student present here today, and everyone that has joined us. My name is Eunice Odeyemi, as I've been introduced. I don't know, I have a slide, but I learned I have just 7 minutes to talk. I don't know if there will be chance to go through that. Is it okay if I share a slide, Ms. Bolale?
Okay.
Okay, sorry about that. How many minutes is the slide? You can go ahead. If it's a short slide, it's fine.
All right. I'll quickly do that. Okay, can you see my slide now? Miss Balanle, can you see my slide?
Yes, we can see your slide. I can see it.
All right, so I can just start. Okay, sickle cell disease. I'll start from what sickle cell means. Okay, let me put it on slideshow. Or is it okay like this? Okay, let me just rush because of the little time I have. You can let me know once I've spent 5 minutes, please. I don't want to exit my time. Okay, so sickle cell disease, we are here to know about it. But the first thing we must realize is that sickle cell disease, they are a group of genetic disorders, and they are disorders of hemoglobin. We used to know as our great parents in the past, they used to say that they are evil spirits, they are angels, they are. Can you hear me?
Yes, we can hear you, ma'am.
Sorry?
Go ahead, doctor. We can hear you.
Wait, you are breaking. Can you hear me?
Dr. Odeyemi, we can hear you loud and clear. Go ahead.
All right. So I was saying sickle cell disease is they are groups of genetic disorders of hemoglobin, as against what it used to be known by our parents, grandparents, maybe some few young ones even now believe that it's an evil spirit, like an ogbanje, abiku, things like that, just because of the recurrent illness that they do have, and some of them childhood deaths recurrently occurring. So it brought about that belief that they are spirits. Some even believe it's an infection. Once you come in contact with someone with sickle cell disease, you can have it. All these are not true. It's actually a genetic disorder of hemoglobin, and it is inherited from both parents. No one parent can transfer this disease to their offspring. And it's a kind of disorder that brings about red blood cells changing their shape, their function, their orientation. It gives them the tendency to become sickle shape, just as the name of the disease, or crescent shape. I'm going to be showing us pictures. So if we look at this slide, we have a normal red cell, the normal round shape, almost round shape, while the sickle red blood cell is a form of sickle, like a C shape, banana shape. That's what happens within our vessels when someone has this disease. This is the way their red blood cells they form it with it occur most of the time. And the sickle, I would like to compare normal red cells with sickle red blood cell. Normal red blood cell only contain hemoglobin. So hemoglobin A is the only normal hemoglobin. The other hemoglobin S, hemoglobin C, hemoglobin beta thalassemia, both major and minor, D and E, all these are forms of abnormal hemoglobins. And sickle cell would only happen when two abnormal hemoglobin occur together, whether 2S or S combined with other forms of abnormal hemoglobin. When normal hemoglobin A combines with an abnormal hemoglobin, A is meant to predominate because the form of inheritance is an autonomic recessive. So A, which is the normal one, is going to dominate until two abnormal hemoglobin occur together. That's when you can have an abnormality. Of course, I've talked about the shape before. The flexibility, also the different flexibility. The normal one is flexible, is able to maneuver through the vessels, the tiny vessels, and then bounce back to become its round shape, while the sickle cell cells are not able to do that. Then the lifespan, a normal red cell is supposed to live for 90 to 120 days, but a sickle red cell has a very short lifespan of maximum of 40 days, most of them 10 to 20 days. So you see why they cause the effects that we see. And the effects that we see includes the recurrent pain. This is because once they form sickle in that manner, sometimes they are able to recoil back, but sickling and unsickling makes them become permanently deformed and then clog the vessels, blood vessels. And once blood vessels are clogged, they are blocked, there is no blood supply to parts of the body. So it gives pain. They have bone pain, back pain, abdominal pain, chest pain, pain in any part of the body can occur. And this is what happens in various organs and tissues of the body that brings problem. Then the chronic anemia we can relate because of the short lifespan. They are chronically in the state of low blood level, and some of them they are able to live with it. That's why we usually ask for their normal blood PCV. That's normal blood level. We can't compare with people who do not have sickle cell disease because their normal PCV is usually at a low level. Then the recurrent hemolysis, that recurrent breakdown of red cell, recurrent jaundice, this happens, yellowness of the eyes because of the constant breakdown of red cell. They release the bilirubin, which colors their eyes yellow, and then various organ damage. Well, it has to be known that the clinical presentation of people living with sickle cell disease differ greatly. Some people have sickle cell disease and they rarely manifest any of these symptoms, while some have it, and right from childhood, they are in and out of hospital, various complications coming down with illnesses at multiple times in a year. So the clinical presentation differs and it depends on certain factors. I would not like to bore us with that right now. So this, to just show you what I just explained, this is a red blood cell, the normal one and the sickled one. The sickled one is the one that clogged together. If you can see my cursor on the limb of the vessel that is above, that is the sickle cell that clump together, and thereby we have obstruct the flow of blood. Then I would like to let us know that sickle cell disease affects millions of people worldwide. Where, however, the most number of people are seen in sub-Saharan Africa. Up to 80% of the global population of people with sickle cell live in sub-Saharan Africa, and others are in Middle East, the Central India, Mediterranean regions. We must also know that our Nigeria bears the world's highest population of people with sickle cell disease. 25% of people in Nigeria, they are carriers. I'll talk about being carrier state and having the trait of sickle cell. That is, 1 in every 4 people we see have one normal hemoglobin and one abnormal hemoglobin. Why 2 to 3% of people in Nigeria have the disease, which is a whooping number. And newborns that are babies that are born with sickle cell disease annually run up to 150,000 in Nigeria. So this is just a map showing the distribution. So as I was saying the other time, the autosomal recessive disorder inheritance pattern of sickle cell disease. So it takes 2 parents to come together to give a child sickle cell disease. As we see, these 2 parents, they are carriers. Carrier state means they have one normal hemoglobin and one abnormal hemoglobin, whether it is A and C, A and S, A and any abnormal hemoglobin, but they have one A and one abnormal. So they can only give their child the disease when they donate. The abnormal side is the red side, while the normal part of their hemoglobin is the blue side. When they donate the red side to a child and the child has all red, that means it has 2 abnormal hemoglobin. That's when the disease can manifest. These 2 middle ones, they are just carriers. They will not manifest. The blue one is not affected at all. So we should understand that is important in preventive counseling. So this is just another way to look at it. Okay, so what are the various scenarios that we can have when 2 parents come together, when they are AA? I think we can hazard a guess. No, these AA parents, both are AA, they are not going to have any child with sickle cell disease. Parents with AA and the other AS will likely not have, because one parent does not have any abnormal, while AA and AS, because it takes 2 parents to donate. If despite that one parent has the disease, it cannot pass it to any of their children because the partner does not have any abnormal hemoglobin to donate. So all their children will be AS, all true. While the other forms that are below, in the lower line, all of them have one, they have risk of having children with sickle cell disease. And this table shows it well. we not want to bore us, but we should know that the last 3 sets of combination, we can see that 1 out of 4. This does not mean 1 out of 4 children. It just means that every pregnancy has a 25% risk of being sickle cell disease. All of the 4 children can be AA, but every pregnancy carry that risk of 25%. Why those that are AS and SS, 50% of their children there is 50% chance of every pregnancy to have sickle cell disease. While if SS marry SS, of course, we know what should happen. What are the problems of sickle cell disease? People living with sickle cell disease, they are at risk of having recurrent bone pain. I've explained earlier, infants less than 1 year, they can have swelling of their hands and their feet. We call it dactylitis. Stroke is a major issue in the sickle cell disease, especially in children, although it is largely preventable. This is my own area of interest, and it's been said that because, okay, let me not bore us with this. Studies have shown that if they are being checked every year by in a test we call TCD, that's transcranial Doppler ultrasound, we are able to predict, at least to a certain extent, those that are likely to have stroke in the next 1 year. So when we see that, we are able to counsel and put in a preventive measure to prevent them from coming down with stroke. Acute chest syndrome, this is like having crisis of the chest in the lungs. Imagine when the blood vessels to the lungs are blocked. It's a very fatal complication, if not promptly addressed. So acute menstruation crisis is also common in children when their blood are trapped in their spleen, and they can come down with shock and all sorts. Recurrent infection, because the spleen is, when the spleen is affected, the spleen plays a major role in preventing us from having infection, but because of the scarring that could go on in the spleen, they are predisposed to having recurrent infection. Leg ulcers, avascular necrosis, that's when the red vessels in particularly the head of femur, head of humerus are infected. That's why you see some of them limping from destruction of the hip joint. Then renal problems, you can see them have bedwetting because they are unable to concentrate their urine. They pass lots of urine and they can bedwet. They can have kidney failure. Men, adolescent male, even children can have what we call priapism, which is a purposeless, painful penile erection. They will just have this erection that will be so painful and needs to be promptly attended to, because if not, it can lead to infertility. Then they have problems that delay puberty. There are other problems, but these are just the ones I want to mention here. Then social problem is also there, stigmatization, school absenteeism from being in and out of hospitals. They're not really productive at work because of one illness or the other. Emotional distress, both to them and the family, their carer. Reduce overall quality of life. Families have been disrupted because of the burden of to take care of a child with sickle cell, and then of course the financial strain on their carer. So how do we manage them? Yeah, people with sickle cell disease, they are advised to always stay hydrated, always drink water, so that dehydration is one of the precipitants for their crisis. If they drink enough water, their blood is flowing well, is not thick, it's able to put through all the clogging and obstruction of the in the vessels. Extreme temperatures, being too cold and too hot weather can also precipitate crisis. Strenuous exercise, and when they also do not rest well, all this can precipitate crisis for them. And then they are supposed to attend their clinic routinely for life, because the genetic disorder that does not go away, it lives with them for life. So they are supposed to, because their doctors know what to see them for, their counselors know how to engage in their life matters at every step of the way. Then vaccination is very important, especially for children under 5, because I mentioned the spleen infection, their spleen is dysfunctional, and then ability to control infection is low. So vaccination and even to have boosters of vaccination is really important. Then there are routine medications. Some medications help them to maintain their blood level, though still low, but not falling too short of what their body can cope with. And they should avoid iron-containing medications because they are at risk of iron overload. Then, of course, they must know their warning signs and know when to seek medical attention. Then psychosocial support is necessary for them. They should join support group. They are going to see a lot of help and counseling and things that they need to do to help them. Then psychotherapy is important because of those that are depressed or anxious and things like that. Then for all of us, we need to know our genotype, which is the main reason why we are gathering today. We need to know what our genotype says. Thank God the laboratory scientist is in the house. She's going to tell us various ways how we can know our genotype. Many people are falling the victim of saying the lab told me I'm hey or I'm hey I'm hey, and then they eventually got married, have a child with SS. They wonder what happened. Well, there are so many tests and there's so many labs. I would advise to test and test again, verify again, check in another lab, check in a reliable laboratory. There are many tests. I don't want to go into that and be sure. Then premarital counseling, before you go into marriage, we should, especially when you know your own genotype is AS, get your partner tested. Both of you should go together, have the counseling and get tested. Then make informed relationship choice. If you have decided that, oh, this person, I love him, I love her, and I don't want to let go. So you must know what you are going to in there to face and be ready for it. Although there are options that you can look into, you can look to IVF, that in vitro fertilization, prenatal genetic diagnosis. You can select the gamete, that is your egg with another person's sperm, or your husband's sperm with another person's egg. These are options just to avoid having a child with sickle cell disease. Then neonatal screening. A child is found to have sickle cell disease, there are ways to go about it in order for the child to have as much as possible minimal complications. Then we need to give support to people that are living with sickle cell disease. We should not stigmatize against them. And then we should let everybody know, everybody around us, be aware of the sickle cell disease, how it can present, and what we can do to minimize suffering for those that are living with it. And this is a general advice that if anyone among us has a sickle cell disorder, it is not the end of the world. You are just a special being who needs to take special care of yourself. You can do what others are doing, but just know your limit. Know when your body is telling you to calm down, and do not compare yourself with others. If you are AS and you are already married to a husband or a wife with AS, well, you are married, but I've mentioned earlier what options are available to you. And if you go ahead and marry, it doesn't mean you should have a sickle cell patient, but you can have. If you don't have, that's fine. If you have, let them be, take them for proper attention in the hospital early enough, register them whether they manifest disease or not. There are things they need to do for them early in life. Then if you have children with sickle cell disease, do not take them to pharmacy. Don't just buy any medication for them. Let them go to proper specialist hospital where they can be cared for, and so that they can minimize complications now and later in the future. Well, is that a cure? I'll say yes. It is called stem cell transplantation. This is when bone marrow of a child, a normal person with hemoglobin AA, is transfusing to somebody with sickle cell disease. But this is not advised for everybody. It's for children with severe manifestation of the disease, and it does not come without a risk. There's risk of a rejection. It's high maintenance. You have to be on immunosuppressant. That's medication to suppress your immune system so you don't attack what was transplanted and things like that. There is also an option of gene therapy, but this is I would say it's still in research, and people, it's not yet what we practice. Okay, that's all. I'm sorry I had to rush through it, and I think I've taken more than my time. Thank you for listening. Thank you for giving me the opportunity again.
Thank you very much, Dr. Edoyemi, for that enlightening presentation. We really appreciate your time and expertise. Before we move to the next speaker, please, I would like to invite the lecturer in charge of this program. the person of Mrs. Fumi Falobi to give us a speech on development and communication, how it promotes awareness. We have the floor, ma. You have the floor, ma, Mrs. Falobi. Thank you.
Good afternoon, everyone.
Good afternoon.
I'm glad to be here, and I know that all of us are glad to be here. And this is a campaign. This is a campaign about sickle cell awareness in the society. In fact, when the class came up with the idea of the sickle cell, everybody was glad, and we were like, okay, it's good to create awareness about sickle cell. But the truth also is this seminar, this webinar that we are doing is actually part of the course, Development for Communication. And the goal of Development for Communication is to change the behavior of people towards a particular cause and to cause a kind of action, positive action, in order to have a better society. So when they came up with this sickle cell awareness, and I've been given to talk to explain to speak on the importance of the importance of creating awareness on sickle cell. I discovered that there are so many myths, as our facilitator has told us. There are so many myths, misconceptions about sickle cell. And this is where development communication actually comes in. And as communication professionals, it is our own job to ensure that we spread accurate and factual information to dissuade so many of these misinformation about sickle cell. For instance, people believe that these people, they are ogbanje, they are rich. In fact, there is one that I had recently. The child is a sickle cell, and the father has like nearly abandoned the child and with the mother because he was like he's already tired. Does it mean that this child, it is when there's money with him, that is when this child will now fall sick until they spend the money and everything? That's when this child will not become better. So people have a lot of myths and misconception. But it is important that we go there out there and tell them the facts about what sickle cell is all about, and also the prevention. When it has happened, it has happened. There is nothing we can do. But the most important, and I think the most important aspect of this webinar is to create awareness about how to prevent sickle cell, because in the course of research, I discovered that they said in every 13 African American, one is SS. So how can we then now ensure prevention? And this is where we come into as communication professionals. We need to enlighten people out there to let them know that it is important for them to know their health status. When you are in that relationship, know your health status, know who you are. And when you know you are, it will help you before you say I do. Because when we know who we are, we got tested, we will know our status, we will know our health status, and we will know whether to go ahead in that relationship before it will lead to marriage. And for the people living with sickle cell, we must show care, we must show love to them. And that is the only thing that helps them to move on in life. And when all of us, we play our parts to educate people out there, we create a world of difference in overcoming stigma and correcting misconception about sickle cell. So I want to appreciate this class, the postgraduate class, in the course in the Mass 702 Development for Communication for coming up with this initiative. And I thank our facilitators and every participant. Thank you.
Thank you very much, Ma, for that enlightening presentation. You really educate us, and thank you for your guidance always. So before we move to the next speaker, we know people have questions to ask, but we won't go into the question next. Let's go to the next presentation. The next presentation that we are going to listen to is the one from a medical laboratory scientist, the person of Miss Sunday Joy Ebubechi. Ms. Ebubechi is a graduate of Nnamdi Azikiwe University with over 3 years of combined academic and practical experience. She has been actively involved in health awareness campaigns and community outreaches, and she has a passion for medical knowledge. Simple and impactful, she is always ready to take us on this type of presentation. So I use this medium to welcome Ms. Ebubechi to take us on the topic, caring for the affected and reducing stigma. We have your attention, ma. Miss Mary.
Okay, good afternoon, everyone. Thank you so much for having me. It's actually a privilege to be part of a campaign like this one. Okay, so we've already heard about what sickle cell is, right? And we've heard about how it comes about. But I would like us to actually pause for a moment and actually think about something. What does it actually mean to wake up every day living with sickle cell? What does it actually mean if we can put ourselves in their shoes, the shoes of people that have or people that are dealing with this sickle cell? It actually goes beyond hospital charts and laboratory results, right? And as I've rightly been said, I will be speaking on caring for those that are affected and reducing the stigma. So it's for people living with sickle cell, yeah, it's not just a one-time diagnosis. It is a daily experience. It's something that they live with on a daily basis. One thing that they face is chronic anemia. Let me not use serious, big medical terms. Anemia is just simply shortage of blood, when there is shortage in the level of blood, right? And chronic means it's very severe. It has gone past the mild states, right? And for patients living with sickle cell, it means they constantly have to battle fatigue. They are constantly tired, meaning that things as simple as climbing the stairs, fetching water, dancing, running, jumping would actually leave them very, very exhausted. They also have to deal with pain crisis, as the doctor has mentioned earlier. When we say crises are severe episodes of pain that they have to go through. And usually sudden. It's not something that starts over, or maybe they've seen signs and then they're waiting for you to come and meet them. No, it actually comes sudden. It doesn't give warning, right? And it occurs when there is an obstruction to the flow of blood. For a healthy person, we need blood. We need our blood to move things around in our body, oxygen, nutrients, and everything. But for people with sickle cell, now, because the shape of the cell is not as it should be, is in that shape of the letter C, it's sickled, it could lead to obstruction. It leads to obstruction. So when this obstruction to the flow of blood happens, right, they come down with what we call crisis. Let's take, for example, now, a student that has an important exam to write, and the pain comes. Every other thing is put on hold, whether the person wants it to or not. The person will not be able to do anything. And then let's also look at the frequent hospital visits that these patients would, or that they go through themselves and their families. They frequently have to visit the hospital because they may need regular blood transfusion again, because the lifespan of the blood cells are not as it should be. The normal is about 120 days, but for them, it's actually far lesser than that. So they need constant blood transfusion. They also have, they could maybe come down with infections. They are prone to infections because of the state of their health. They also have recurrent bone pains. All these things could result in emergency admissions, right? So let me use layman words, like they're a regular customer to the hospital. And they also, now beyond the physical thing that we are seeing, like the anemia, the pain, and then the hospital visits, they also have the emotional turmoil. These patients would deal with depression. There is nobody that would actually like a state where you are being seen as being invalid or being incapable or being fragile to do things, right? And this is something that they have to go through. This is something that they experience. They deal with frustration. They deal with anxiety. What if I come out and mingle with these people? What if they say? What if they don't say? What if they don't like me? Do you get? They always deal with rejection. They are being compared constantly, regularly with their peers. That alone is enough to weigh them down emotionally. One thing also that they also deal with as their reality or their daily reality, what they deal with, either all these things, it affects their education, it affects their relationship with people, even career aspirations. Some of them may feel, oh, since they say people that have sickle cell most times don't live long, what's the essence, right? But we should know that when we're talking about this, we are really talking about a real human, just like we are, that deal with this thing on a daily basis. It's not just saying medical things and then thinking, oh, it's just sickness. No, this is a real person dealing with all these things. Now, where does this care come in? How do we care for these people? This is where the family and the community comes in. For the family now, it begins with simple things. Like the doctor said, you encourage hydration, ensure that they are hydrated. When they are dehydrated, is a very bad trigger for them to actually come down with crisis. And they must always equip themselves with diets that are rich, right? That's simple terms, balanced diets. That's the fruits and veggies. They shouldn't even joke with that one. Then the families will also ensure that these people take their medications judiciously, like they have to take it. Medications like folic acid that would help to build new red cells. They also help them avoid extreme temperatures, because there are sometimes these people may feel, oh, we want to feel like the normal. We want to feel like every normal person, and they would not take into cognizance all these things. So this is where the family comes in. You would help them, right? Help them avoid extreme temperatures and anything that would make them prone to infection, because they're actually susceptible. So anything that would trigger infections, the area where they stay, everything, the family would have to involve themselves in it actively. Also, the family would also have to recognize early signs of crisis, like sudden pain or swelling. They may maybe overlook it, but then again, the family, they have to now educate themselves on these signs. What are they looking out for? Sudden fever, sudden pain, swelling, and then seek medical help when things like this occur. Most importantly, the family would also have to offer emotional support to these people. The family would have to exercise patience. The family would have to be understanding and frequently, regularly give them reassurance. The families, they would have to avoid blaming them, right? Or labeling them invalid people or people that are fragile. Then the community, the schools, the workplaces, religious bodies, they would have to also be understanding, also be patient with these people, right? And not look at it like they are being lazy. They should see it as this is someone that is actually going through a lot. Then the faith communities, that's the church, the mosque, they would have to now help in debunking those myths about sickle cell. Things like they are ogbanje, or it's an attack, or God is punishing the family. They would actually have to come in now to debunk things like that. Then from everything I've seen now, that caring for people with sickle cell actually requires love. You would have to love them, be patient with them, and understand it actually goes beyond the hospital. Now, how do we reduce stigma? This stigma that is associated with sickle cell. Anywhere you say anybody, this person is a sickler. This person is not strong. This person is fragile. This it actually causes them to be stigmatized, right? Then how do we reduce this stigma? This stigma of them seeing themselves as, I'm being cursed, or is an attack, God is punishing them, or banje, or things like that, right? How do we do that? How do we come in to reduce this? This is where awareness campaign like this one comes in, right? Is crucial, because where stigma thrives is in a place where knowledge is absent. In the absence of knowledge, stigma would live, stigma would thrive. So campaign awareness like this one, awareness campaign, we, for example, now we go into schools. This is where these campaigns come in. They go into schools, you teach young people about genotype, you teach them early. Teach them about genotype, that certain genotype shouldn't get married to certain genotype, like the AA. Anything that would, not the AA, the AS, anything that would make someone with AS settle down with someone, another person AS, there is a likelihood of them having a child that will be sickle cell. People that are sickle cell, that's the SS, should not get married to their fellow SS. These are ways, these are things I would teach them about, so that they would make responsible choices. Then in the marketplace, now taking this one now out of school, right? Speaking in the marketplace, we were able to reach the parents, telling them or teaching them how to manage their children, people around them that are sickle cell, right? Teach them how to manage them, because the truth is that for now, I don't think that there is a cure right now for this diseases, sickle cell disease. No, but there are things that it can be prevented and then can be managed, right? Then, as I've said earlier, engaging spiritual bodies, the religious bodies, to debunk these myths with accurate information, telling them that no, it's not what we used to think or what our fathers used to think before. That is just is a genetic condition, right? The social media also gives us a wonderful platform. Like when during the period of COVID, right, the social media actually helped. It did not now make it, it helped in teaching us how to manage that pandemic at that time. If that kind of energy can be pulled into sickle cell anemia, like making people aware, not just seeing it as, these people they are spiritually attacked or whatever. If the same energy that was applied for COVID, and even hypertension, because now I've seen things on social media about hypertension, teaching people on diabetes too. It's now making people take cognizance of, this is what is happening, or this is not what is happening, or if I do this, this would happen. If that kind of energy now can be pulled into this sickle cell situation or condition, there would also be a positive outcome. Then another way now that we could help reduce the stigma is sharing success stories of people that are dealing with sickle cell. Success stories like people that sickle cell people that are doctors, that are teachers, that are athletes too. Again, remember that I said that if they do little activity, they would get exhausted. So if they could see fellow humans like them dealing with the same thing, that are actually athletes, that have actually attained something, that are doctors and that are teachers, it would actually it will actually strengthen them. It will actually give them this zeal to actually want to live, right? It will actually give them this zeal. It will give them the courage, right, to look beyond, they said I'm sick, I'm going to die early, right? Because I think that's another myth too. That is also something that people talk about. People see people that are dealing with sickle cell as people that would not live long. So if they see people that have attained certain heights, dealing with these same things like they are, it would actually encourage them. It would also encourage their family to actually put in the work to help these people dealing with sickle cell live longer, right? To help them change their mindset. So I would conclude by saying that caring for people with sickle cell and reducing the stigma would require a combination of both the medical knowledge and human sympathy, right? Let me use that word, the combination of the medical knowledge and humanity. It just goes beyond telling them, oh, this is what happened, prevent it this way, prevent it this way. The love, the compassion that we have in us would have to come in. It's about treating the body, yes, but it also requires supporting the mind and the spirit of these people dealing with sickle cell. Every patient, every person dealing with sickle cell should not be seen as a disease, but it should be seen as a person, right, that has dreams and abilities. So, and each of us from today should become ambassadors of awareness, correcting these myths, debunking them, encouraging genotype testing. Before two people will go and sit down and say, oh, we want to get married, they should check, they should be sure that, oh, this is my genotype, this is your genotype, can we do this? If they decide to, then they should be able to put things in place that would help them. It's not actually advisable for people that are AS and AS to get married, or AS and SS to get married. No. SS and SS, no. Right? Then with care, understanding, and awareness, we've seen that people with sickle cell can live long. They could live long, fulfilling lives. They could live inspiring lives. Now, together, we could move from stigma to support. We could also move from ignorance to understanding, from this awareness, right? And also from survival to thriving. Thank you very much.
Thank you very much, Ms. Joy, for that wonderful talk. We are able to understand how to care for the affected and how to reduce the stigma. So now we are moving on to the interactive program. So we appreciate if you have any question that you want our facilitators to handle for you, please. You can use the chat box. You can use the raise hand option to ask your question, and our facilitator will surely answer the question. So we have Dr. Deyemi and Ms. Joy to answer the questions. So please, we are waiting for questions, please. Questions? You can use the raise hand option. And you can also put it on video and raise up your hand, it's fine. You can use the chat box too and text your question. We appreciate it, please. Questions from our listeners, questions from our friends, from colleagues. We are waiting for question. Okay, I have a question here from Victoria Adukonle to everyone. Okay, I'll direct this question to Dr. Odeyemi. Sorry, hold on. The question pop up now. Okay, the question goes thus. Is it true that people with AA genotype fall sick more than AS?
All right, thank you, Ms. Bolanle. Thank you. Okay, thank you, Victoria, for that question. You are correct. Some people say people with AA fall sick more than AS. So the kind of illness they are referring to is actually malaria. It is a fact that people with AA genotype they are more susceptible to having malaria compared to those with AS. And if you see the map I showed you, the area where sickle cell is prevalent, it's actually the same area or aspect of the map where malaria is prevalent. So there's a link between the two, actually. That is why sickle cell is still prevalent in those areas where we have malaria endemicity. It's because those with sickle cell, they are able to thrive even in the face of malaria. So that's why we have them in those places. It is true. Sickle cell is protective against malaria. But when they have the disease, the AS is a carrier state, is the trait, is the S gene, S part of the AS that makes it protective. But because sickle cell disease patients, they are already in state of chronic anemia, recurrent infection and all, they can also come down with malaria. Their malaria is even more severe than those that have the AA. But the AA, because there is no hemoglobin S at all, which is found to be protective, so they are more susceptible to having malaria. But not other infections, don't get it wrong. Not other illnesses, just the malaria. Thank you.
Thank you very much, Dr. Deyemi. I also have another question in the chat box. Okay, from Dr. Solomon Oyeleye. He asked the question, he said, if he has faith that it will be well with both of them, you mean the couple, so is it wrong for two of them to get married, even if they are AS genotype? That was the question from Dr. Solomon.
Okay, is the question for me as well?
Okay, let's direct the question to Ms. Joy Sunday.
All right.
Ms. Sunday, are you with us?
Okay. Yes, I'm here. The question said, is if I have faith that to be well with us, is it then wrong? Hmm. Oh my God, how do I answer this one now? I don't know. Let me come from since the person is going through this way now, let me come from the Bible way now, right? It said, if you have faith, that it will be well. But the same Bible also said, faith without works is dead, right? And if you are doing like this, it's like you are purposely trying to test God. You're actually trying to test God. You cannot know what you're supposed to do and then decide that you want to test God because you say you're having faith in Him. Is it then wrong? Medically speaking, it is wrong. If you know that you don't have what it takes actually to cater for someone, because the likelihood of you having a child that will come down with sickle cell or be living with sickle cell, the tendency is there, right? So I just see it as you deciding to do something that you already know is wrong. You are now testing God, though. I don't know. That's just all I have to say. If you know what doing well, you just do it well and leave the aspect that you're coming from, please. Thank you.
Thank you very much. Please, more questions, please. More questions. Okay, I have this personal question, and I'm directing you to Dr. Odeyemi. So if AS and AS give birth to children, what are the early symptoms for them to look out for in that child? What are the early symptoms to look out for to know maybe the child is SS or maybe the child is AS before even going for hospital test or anything?
All right, thank you. When AS and AS, they are married and they have given birth, it's only in this part of the world that we don't do neonatal screening. Every neonate, every child that is born is screened. It's part of, there are so many diseases that are screened at birth. Sickle cell disease is one of them. So they pick it early in other climes, but it's coming to Nigeria. Some parts of Lagos have started doing that as well. Once you are aware that the child is AS, they will not manifest any symptoms in the first 6 months. It's not likely. And the reason being that there's one hemoglobin, I did not mention, hemoglobin F. That is fetal hemoglobin. The hemoglobin that babies, when they were in the womb, that's the hemoglobin that they carry. That hemoglobin wanes off over the first 6 months of life. But it is very a strong hemoglobin. It is protective. It does not make them have any form of, even if the remaining hemoglobin is SS, they will not have it. they will not have manifest crisis. There will not be occlusion. It will not form sickling. But until that hemoglobin F wanes out, that's when they now start giving symptoms like recurrent pain. A little child is not able to say, I have pain. They can just be irritable, not comfortable, crying. And then there's a common symptom I mentioned, dactylitis. You can see swelling of maybe one finger and the feet swelling. And when you touch that place, you feel that it's painful, it's discomforting to them. Those are early signs, I would say. But usually they will not present until after 6 months because of the hemoglobin F factor. But it is advisable once you are AS and AS and you are married, once your child is born, there are tests a neonate can do that will reveal whether the baby carries the disease or not. Thank you.
Thank you very much, Dr. Odeyemi. So please, we still entertain more questions. I'm waiting for questions, please. You can use the chat box. You can use the raise hand option, please. Questions are entertained, please. Before we round up the program for today, please, let's ask questions, please. You can text it, you can chat it. Okay. In the absence of no question, please, let me ask another question that I have on mind myself. So I'm directing this question to Ms. Joyce Sunday. So we know that sickle cell patients, they face a lot of challenges in the world today. Because I remember then when we were young, we used to have these classmates, they were actually siblings, so they have this yellowish eyes or something. So I wanted to ask, is it common with all sickle cell patients to have that like yellowish eyes? And again, what are the biggest challenges that sickle cell patients, according to your experience, what are the challenges that they face among their peers, among their friends that you have idea about?
Okay, thank you for that question. Let me respond to the second one first. Something like that. If can you please repeat the second question again, ma?
Okay, sorry, the question is actually 2 in 1. I said, is it
Hello,
common?
ma.
Hello, can you hear me? Okay, okay. I was asking you that, is it common?
I can hear you.
Okay, I said, is it common for sickle cell patients to have that? If you see anyone with the yellowish eyesight, I don't know. I remember then when we were young, we have friends that they are siblings and they actually sickle cell. So their eyeball is a bit yellowish. So is it common for them to have that kind of eyeball? And then again, I'm asking that, how do they cope with the challenges that they are facing with their pressures from their friends as sickle cell patients?
Okay. For the first one, it's actually, I think it is, no, let me not say I think, yes, because there is something we call jaundice. I don't know if you've heard of it, right? And usually occurs when there is a breakdown of the red cells. When the red cells are broken down and hemoglobin leaks out, jaundice occurs, bilirubin, a component of the hemoglobin, when it actually leaks out and is now excess, right? That would now lead to what we call jaundice. So most of them experience this jaundice. That's what leads to that discoloration of the eyes, the yellowish thing that you said is like in the eyes. That's why, because of that breakdown of cells, of their red cells. Then the second question, you said, what are the biggest challenges? Like I said earlier, one is that stigma that they face, the stigma of being labeled Obanje or Abiku, right? And then being seen as weak people, being seen as incapable people. Then another challenge that they would have, let me go for the children now, their education. They would have to miss classes. They would have to miss class. They would, they may be, like I said, maybe have exam, they will not be able to attend. For employment now, there is most advisable. Most employers now would not want to employ someone that they know would not be giving in 100% of their all into the job. So that's another challenge that I know that they would face. Then they would also face social isolation because they may be excluded from activities because people will think that they are too weak to join or be a part of. When it comes to relationships too, they would face rejection because of this genotype thing. Nobody would, maybe the person coming for them now is AS. AS cannot get married to SS unless maybe the person coming for the marriage is AA. And even at that, some AA people may actually not want to be associated with people with sickle cell. Then I think they also carry emotional, will I call it emotional trauma, emotional stress, because they are constantly having to prove themselves that irrespective of what they are going through, they can be like every normal human being. They constantly deal with low self-esteem too. They constantly deal with depression. Those are the challenges that I've seen that people with sickle cell deal with.
Thank you very much for your response. So we are still awaiting questions, but sorry.
Bawale, please, can I add to the response for the first question about the jaundice?
Please go ahead, ma'am.
All right, so she has explained how the jaundice come about. What I just want to add is because I explained that the severity of clinical presentation differs greatly in sickle cell disease. So two people that are SS do not present the same way. Their severity differs because of there are something we call haplotypes. Some haplotypes have very severe presentation, while some haplotypes are just mild. So you can have an SS patient who do not have jaundice at all. It's possible, it's not impossible. While most of them will have that tinge of jaundice and then might be dipping in illnesses when they are actually hyperimmunizing, when they are breaking down lots of cells. It's the rate of breakdown of cells that determines the amount of jaundice, the intensity of jaundice you're going to see on their eyes. But you can have a sickle cell disease person without jaundice. It's not impossible. That's what I wanted to add. Thank you.
Thank you very much, Dr.
You are muted, Miss Bolanle.
Oh, okay, thank you. So I have this comment here in support to the question that someone asked about if you have faith, can AS and AS marry? So Somifalobi gives us an additional comment here that when the foundation is destroyed, that what can the righteous do? So in other words, he's explaining to us here that in a figurative sense, it is a lack of proper spiritual adornment if AS should marry AS. So we should not put God to the test. That is what the message is all about. So in the absence of no question, we are going to put this program to an end. But before we come to the end, this web, now we really appreciate our facilitators. We really appreciate everyone that makes the program a successful one today. But before we round up, we'd like to invite our lecturer one more time to give us our goodwill messages. And after then, we round up the program. So we have your floor, ma, Mrs. Falobi. Thank you.
Wow, what an engaging and enlightening program. I've really been, I've been blessed and I've been enlightened the more on what sickle cell disorder is all about. And I want to also believe that everybody on the call today has also been educated more than what we know before about sickle cell. I want to appreciate our facilitators, Dr. Odeyemi and Ms. Joy Sunday, for your time, for coming to impact knowledge and giving us more. It has been more because this is what we will go to seminars, we will pay to listen to. We really appreciate you. Thank you so much. Thank you, everybody, for joining. And there's somebody very important and special on the call that I also want to appreciate, and that's Dr. Solomon Oyeleye. He's the Deputy Dean, Mass Communication, Faculty of Mass, Faculty of Communication and Media Studies. He's a big man, you see, he's just there watching us, looking at everything that we are doing. But after my call, he's going to make his own speech too. So we will listen to him. And I also want to inform us that along the line, when I was doing research, only for me to discover that the month of September is the month of sickle cell awareness. I was not aware before. I don't know. So you can see when you are doing a particular program, you become more knowledgeable about it. So this month, we too we have contributed in our own way of carrying out campaign to create awareness about what sickle cell is all about, what people need to know more in order to prevent it, and what we need to do to care for the people living with sickle cell, and to also the information that we need to ensure that we mitigate the effects of stigma that people living with sickle cell um, face in the society, and also to correct some of these myths and misconceptions about sickle cell. I know that we're already equipped, and by the time we go out there, it is the month of awareness. Let us continue to create the awareness. Let us continue to tell people the correct and the factual information out there that they need, so that the more we do this, the more we reduce the number of people that will enter into that marriage and come out with and bring forth children with sickle cell. The aim is to reduce, to prevent the number of people going into marriage without knowing that health. I'm very sure that when Dr. Yeleye will speak, is an health communication expert. So it will give us more about his own experience. Once again, I want to thank everybody. And before we go, we will all on our video and we'll take pictures so that we'll be seeing our beautiful pictures of people that have participated in our campaign. Thank you.
Thank you very much, Mrs. Funmi Falobi. We really appreciate your guidance. We appreciate your lecture. We appreciate your support. Really appreciate you. Thank you very much, ma'am. So just as our lecturer said, please let us on our video so that we can take picture before we round up the program, please. We appreciate that if you can, please. Let's do that within a minute. Let's put ourselves, let's see our beautiful and handsome faces. Wow. 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 I'm seeing beautiful faces that have been hiding. Wow. Wow. Please, let's look at, oh, wow. That's nice. We need more faces, more pretty and handsome faces. Okay. Okay, let's go. Okay. We're taking our pictures. We need more faces. Let's see the pretty and handsome faces behind the scene. Okay. Okay. Are we good, ma'am?
Yes, we are. And
Yeah.
please, Oyeleye.
Dr. Solomon Oyeleye, we appreciate you, sir. Thank you very much.
Thank you very much. All right, thank you very much. Good afternoon, everybody. Thank you to the facilitators. I listened from the point that I joined. I joined a little bit about 17 minutes late, but I enjoyed all the information we have given. Learning takes place every day, and I'm particularly happy about the two perspectives to the question I raised. I raised that question because it's an emerging challenge in contemporary in love these days. So it's something that those of us on the field, educating people, raising awareness, need to question and answer toolkits so that we know how to, we get prepared for things like that. I want to say a big kudos to the class. I think this is the first time we're having this at the PGD level, and that's fantastic. I won't say anything about the scoring. Then Mrs. Falobi, thank you very much. The College of Communication and Media Studies is truly emerging with programs. The sky has enough space for us to fly very well with that college. I just want to tell us that our challenge stop at what we have done today. There's always an opportunity for we decide to take some of the lessons we have learned here and take it to our faith-based groups. Either you're a Muslim or a Christian, or you belong to a society where you can talk to 20 people, 10 people, and that way we devolve we scale down the understanding and the awareness and the impact. You may not know, someone may just be in that meeting that it is what you say that will save a future. I love the aspect of having people who live with sickle cell. There are people with sickle cell, and saying they are patients, it means that you're also stigmatizing them. There are people living with sickle cell. Currently, I'm working with one. She's clocking 50 by next month, and we're writing a book. When she was 40, we wrote a book. Now I challenge her two. And yesterday she sent a draft to me. So people like that, we can use and to encourage those who may feel out of the way. So let me not take our time again, having digested so much this afternoon. I just want to say thank you to everyone and for the privilege to be here. Sorry you won't be able to see my face because I'm also doing some other things at home that I'm not properly dressed for this occasion. But I could not resist joining because it's an interesting area for me. Thank you very much.
Thank you very much, sir. Dr. Oyeleye, we really appreciate your presence, sir. Thank you so much. So at this point, we are moving the program to an end. So I will invite my colleague, the project team lead of this program, to close the program for us. Thank you very much. Mary Eyaro, we have you on the floor, please.
Thank you very much, Mrs. Bola. I want to use this opportunity to thank everybody for joining in. Thank you, our facilitators, our guest speakers, our lecturer, our HOD. We want to say a big thank you. This wouldn't have been possible without everyone here. So actually taking this time out to thank everybody and the team especially for making this seamless. I hope that with all we've heard today, that we are agents of change. We don't spread the stigma, but we spread the message and, teach the next person that sickle cell isn't a disease that you should stigmatize people, right? But you should take care of those people, know your genotype on time, care for those people, and also prevent sickle cell from spreading any further. Thank you so much, everyone. Mrs. Bola, you're muted.
Thank you, everyone. Do enjoy your weekend. Thank you. Thank you. We love you. Bye.